It's the month of May. Join us as we dive into the facts, the risks and prevention strategies surrounding one of the most prevalent, yet often misunderstood health concerns, skin cancer. Today we are joined by Dr. Mohammed Abib and Dr. Olufolakemi Coal-Adeife, who will shed light on how to protect yourself and your loved ones from one of the most devastating diseases, from simple yet effective sun safety practices to understanding the importance of regular skin checks. We are here to arm you with the knowledge you need to stay safe.
May is World Skin Cancer Awareness Month, and it is significant as it's a time where for the whole of the month, dermatologists try to raise or improve awareness about skin cancer, and this can promote early detection and also help with prevention of skin cancer.
Usually, sun is the major cause of irritation to the skin that results in skin cancer.
And as the world grapples on with the challenge of raising awareness about the danger of skin cancer, a surprising number of people remain unaware of what skin cancer actually is.
Cancer is an abnormal growth. This is usually an occurrence of abnormal cells in the body, and these cells are able to invade the normal surrounding cell around them, and they are also able to transfer or disseminate to distant sites, that they are able to spread to other sites of the body. These are cancers. So the one that originates from the skin is skin cancer.
We are all made up of cells, and these cells are programmed to grow and stop growing, when there are enough cells. But in cancer, the signal which tries to turn off or is meant to turn off the cell, the signal that is meant to prevent the cell from continually growing or replicating is not functioning properly. And so you have some abnormal or rogue cells that continue to replicate in parts of the body where they are not needed, and they eventually starve or cut off the nutrient and blood supply to the normal functioning cells. This can happen in any part of the body, including the skin. And the skin has different types of cells in it. It has different layers. The skin mainly has 3 layers: the epidermis, or the outermost layer, the dermis, the middle layer, the hypodermis or subcutaneous layer is the innermost layer. And these layers are made up of different kinds of cells. And any of the cells in these 3 layers of the skin can develop cancer.
Skin cancer account for more than 3 million new cases. However, in this part of the world, it's not as common as it is for the white people, like in New Zealand, in South Africa, and some other, the Caucasians generally. And the predisposing factor is lack of melanin. That's the melanin that protects us, which is the black pigment. It is commoner in albinos in our own terrain, because the albino also lack the normal melanin that we have.
And apart from ultraviolet exposure, which has been established as a potential cause of skin cancer, the use of untested organic and natural cosmetic ingredients such as aloe vera and other skincare products containing chemicals can also endanger the skin's health, and these may pose a potential risk of skin cancer.
Well, generally, natural products may be safe, but in medicine, we only talk based on trials. I'm not aware of any trial that involve aloe vera. However, generally, natural products, are safe to use. But we can have other agents like tobacco, that's cigarettes. We can have alcohol, excessive, all this, and then chemical irritants. Chemical irritants like formaldehyde, like paraben, these are also chemicals that, in association with dye, that can cause skin cancer. Even infection with human papilloma virus can also cause skin cancer.
There are concerns also about skin lightening agents, because with skin lightening creams and soaps and agents, you are actually removing or inhibiting the melanin on the skin, which is protective. So over a long period of time, if people continue to inhibit the melanin on their skin, which is protective against the UV rays of the sun, there are chances that they may increase their risk of developing skin cancer over a long period of time. And this is one of the reasons why skin lightening agents are generally not recommended by dermatologists. So even though the data today does not really show a direct link between skin lightening agents and skin cancer, we think that in the future, because of how common skin lightening has become today, we believe that, or we are projecting that we may see an increase in skin cancer due to prolonged use of skin lightening agent for this reason that I've just explained.
And while occasional use of these cosmetic products may pose minimal risks, the prolonged and repeated exposure over time may increase the risk, nonetheless different from person to person.
So the length or the duration of exposure differ from person to person. We don't have the same tolerance. So different people have different tolerance. While some can easily be prone to it, others may take longer time before they eventually come down. But generally, we know that it's chronic irritation, which means something that irritates for a long time, even including deodorants.
They usually work very slowly and they take a long time of the cumulative effect of exposure to these chemicals. So it's not a 6 month, 1 year situation we are talking about. We're talking about a situation of up to 5 to 10 years, and that's the same thing, for instance, with lung cancer and smoking.
Prevention, they say, is better than cure. Therefore, it is advised that individuals endeavor to resist being exposed to these chemicals, especially through various cosmetic products that are applied directly to the skin.
What you do is you abstain from the chemicals. Once you've been exposed, so you abstain from it. Immediately, if it is a cream or anything like that, or direct exposure, you can wash off the chemical, you can wash it off, but then you put in measures to prevent further contact.
Furthermore, it is imperative for government and medical bodies to step up. There is a need to raise awareness about skin cancer and formulate policies that curb the use of harmful cosmetic chemicals.
I believe that the government needs to have stricter, more stringent regulation of the production of cosmetics, and also what is called cosmetovigilance. Make sure that they monitor what is on the shelves. Make sure that they monitor people selling online, because these days almost everything is being sold online. And be sure that those who are selling things online are properly trained in cosmetic formulation or cosmetic chemistry and understand the need for safety assessment and the hygienic assessment of their products. Dermatologists constantly educate people both online and offline, in the clinics, in the media, in social media, about the dangers of using unregulated or unlabeled chemicals on their bodies, using unprocessed things on their skin or on their bodies, because these can come with unwanted effects.
Finally, as we commemorate the World Skin Cancer Awareness Month, it is essential to take proactive steps to safeguard our skin. We need to educate ourselves about the potential risk of cosmetic products and opt for safer alternatives. We can reduce our exposure to potential risks to our skin health. Together, let's share awareness and save lives. For more interesting content, do visit our official website at guardian.ng, and you can also follow us on all our social media platforms at Guardian Nigeria. Khalid Bada is my name. Bye for now.